Hello and welcome to Community Health Journal. We begin today with the future of healthcare. In our region and across the country, it is facing unprecedented challenge. Whether it's finding enough clinical staff, declining reimbursement, or uncertain national health policy, navigating today's healthcare environment is at its best unpredictable. A leader of Providence Health and Services, which includes Kadlec, shared this message with attendees of the recent Regional Economic Forum of the Tri-Cities Economic Development Council. Kadlec has served as presenting sponsor at this forum for 12 years. It's an important community event to learn of the health of our region's economy, including healthcare. Approaching 6 years since joining Providence, Kadlec has benefited in many ways from the partnership. In his keynote address to the forum, the Chief Operating Officer of Providence's Washington, Montana region shared specific examples of how patients in the Tri-Cities area benefit.
We have a network of neurologists across all of eastern Washington and North Idaho that can beam into the different emergency departments and take a look at a patient who might be having a stroke and decide, do we need to get them right away to a higher level of care, or can we manage them closer to home? And so that's one, getting them the right clinical decision they need, but also not, eliminating a hardship of a family having to leave their community for care, maybe be in the hospital for a few days somewhere away from home that they don't need to be.
O'Brien says there's a shared responsibility to address the complex challenges of healthcare today. You can look no further than our own area to see the severity of these challenges.
In 2019, I just saw this morning, more hospitals closed in the U.S. than any year in the last decade because of the tension of, you all know as well as I do, a long-term trend of expenses being greater than revenue is not a sustainable strategy. And we're seeing that more and more. Here in our region, we've seen a hospital in Yakima close, and a couple of years ago, a hospital in Walla Walla after over 100 years close as well. And so part of what's happening inside is this pressure on the existing delivery system that's pushing folks to maybe not continue to provide access in the communities they've been serving historically.
Being able to partner with a strong system like Providence has brought a deep focus on solutions and strength in numbers. O'Brien points to system-wide work to improve quality and utilizing data to drive performance. He cites just one example in the specialty of orthopedics.
There are different kinds of cement. So there's just a conventional cement, and then there's an antibiotic bone cement. And the antibiotic, as the name suggests, is in theory going to reduce the risk of infection, which nobody wants, right? The antibiotic bone cement is about a couple $100 more than the other one. One of the things we were able to do because we're a part of Providence, and the physicians were choosing to use that with the best of intention, hoping for the best outcomes for their patient. We do about 18,000 of these surgeries a year in our system. We were able to compare those that use one or the other and see if it was true that there were actually different rates of infection. And we found that there was no difference. And once we were able to share that data at that scale with our surgeons, it was amazing how their behavior changed, and we were able to pull a couple $100 out of the system for every case.
You might think that the origins of Kadlec and Providence are vastly different. Colonel Kadlec, the namesake of the hospital and a founding leader of Hanford at the height of the Manhattan Project, and Mother Joseph, one of the founders of Providence more than 160 years ago.
On the left here, this is Mother Joseph, who landed in 1856 at Fort Vancouver. She's one of 2 Washington residents in Statuary Hall at the Capitol building. She's the one who came here in a wool habit, serving everybody from here to Missoula. And then this is Colonel Kadlec, who founded Kadlec. And I think both of these individuals give us a great example of serving others, asking the question about what the community needs, and then bringing people together to make our communities healthier and stronger.
Fast forward to today, and these missions are closely connected. It's the strength of this partnership, Kadlec and Providence united in a shared vision of health for a better world.